Well, welcome everyone, and thank you for joining us today. This is going to be a live discussion style webinar where we'll discuss some of the most common questions caregivers ask when caring for a loved one with dementia, Alzheimer's disease, or some type of age-related frailty. My name is Stacy Campbell, and I'm the outreach coordinator with Passages Caregiver Resource Center in Chico, California, where we help support, educate, and empower caregivers who are caring for a loved one who has some type of a cognitive impairment or who is frail and elderly. Today, we'll be discussing 6 important caregiving topics: understanding dementia and the brain health, everyday caregiving challenges, health, wellness, and safety, caring for the caregiver, planning ahead and understanding care options, and finding support and resources. I'd like to now introduce my co host, Michelle, and let her tell you a little bit more about where she's from.
Hi, Stacy, and hello to our viewers. My name is Michelle Rios, and I'm a family consultant with Coast Caregiver Resource Center. And we're located in Santa Barbara, covering the counties of San Luis Obispo, Santa Barbara, and Ventura counties. As a family consultant like you, Stacy, I support the unpaid family caregiver or caregiver of choice. We are with the caregiver through their caregiving journey, and we provide support through consultation, education and training, connection to resources, as well as other services that they may be qualified for. But I think the biggest thing that we do is that we walk alongside them and we're there as a person that they're able to come to, ask questions, sometimes just get things off their chest. So I'm happy to be here and I look forward to our discussion.
Thank you. So do I. Thanks, Michelle. Caregivers often find themselves searching for answers, whether it's managing memory loss, handling difficult behaviors, keeping a loved one safe, or just simply wondering if they're doing the right thing. Today, we'll explore some of those most common caregiver questions and share some practical information, resources, and guidance to help make your caregiving journey just a little bit easier. So, with that being said, why don't we go ahead and get started? So, like we said, we're breaking it down into 6 different categories. So, the first category is going to be understanding the condition. So, most often, what we hear when we pick up the phone or we, see someone in person that comes in the office, one thing we want to do is try to explain what the difference between dementia and Alzheimer's disease. And dementia is a general term used to describe symptoms that affect their memory, thinking, reasoning, and their ability just to perform everyday activities. Where disease is the most common type of dementia, and it accounts for approximately 60 to 80% of all dementia cases.
Stacy, something that has helped me remember the difference between dementia and Alzheimer's is to think of dementia as a broader term. They will describe it as an umbrella term. And
Mhm.
not to make light of the situation in any way, but I try to find ways to connect to things that help me understand. And so in this case, what helped me with dementia was to think of it as a pasta. If you go to a restaurant and order pasta, the waiter cook will have an idea of what you're asking for, but there are so many different types of pasta. So
Mhm.
dementia has many different components or parts to it. And so if I ask for pasta, somebody may ask me what kind of pasta and what's the most common pasta? It's going to be spaghetti. So, like spaghetti, Alzheimer's is the most common form of dementia.
I love spaghetti, just to let you know. On a side note, so that's a good analogy of it. So while there is currently no cure for Alzheimer's disease, which we're asked quite often, that research has shown that healthy lifestyle habits may help support brain health and slow down some cognitive decline. And one of the most important lifestyle factors that we need to keep in mind is regular physical activity. And see how I put regular in front of there? Even if you carve out 2 times a week, just try to keep that what we call rocks in your calendar, but just make sure you get that regular activity exercise. As we know, exercise can help increase the blood flow to the brain. It supports cardiovascular health. It improves mood, promotes better sleep, and it may help maintain some cognitive function. So those activities such as walking, swimming, chair exercises, dancing, Tai Chi, or strength training can provide benefits for both the body and for the mind.
Yeah, one of my favorite activities is dancing. You can ask anybody that I know. So it's also a great opportunity to bond with your loved one. You
Mhm.
can do it from a chair, from the sofa, and just moving your arms, putting on some music that brings back good memories or anything that just makes you move. It's all about the feeling and the exercise and the blood flow to the brain. So great idea. So that's such an important distinction between Alzheimer's and dementia. Thank you for clarifying that, Stacy. But now thinking about those two, is there a cure for Alzheimer's or dementia?
Well, at this time, most forms of dementia, including Alzheimer's disease cannot be cured and it cannot be reversed. However, there are some conditions that may mimic dementia symptoms, such as medication side effects, vitamin deficiencies, dehydration, depression, thyroid disorders, or infections. Those may be treatable and sometimes those may be reversed, but no, there's no cure or reversing for it.
So early
What do you
diagnosis then would still be important because it'll give the person an opportunity to see a doctor, start making lifestyle changes, and take medications that
correct?
can help with symptom management, right?
Yes, exactly. Exactly. So the sooner that the concerns are addressed, the more opportunities families have to take those proactive steps, which means that they can help make their loved one a little bit more comfortable and life can be, lived a little bit longer as possible. So with that being said, how important that understanding the diagnosis is, most caregivers tell us that their biggest challenge happens in everyday interaction with their loved one. So now we're going to jump into our next segment, which talks about daily care challenges. So, Michelle, how can an individual communicate better with someone who has dementia?
I would say use simple language, maintain eye contact. When you're approaching your loved one for a conversation, a question, or any type of interaction, you want to approach them from the front and definitely be aware of your body language and your facial expressions. If you're calm and happy, then that is a good sign to anybody that is approaching you, right? So even with frustration or anything, take a deep breath. Um, Bring a sense of calm, and if you can, a smile before you approach your loved one. Allow extra time for responses. When you ask a question, it's going to take them time to process the question that you're asking and then to formulate a response for you. So be patient. Eliminate any distractions, any background noise,
Mhm.
anything that you think could have a negative impact on a conversation that you're trying to have. Nice, calm, quiet is better. And then remember, like I said, the tone and the body language is important. That's what your loved one is seeing, and that's usually a sign of what is happening in the situation is your face and your body language.
I
Um,
totally agree with that. One of the things is if you're already in a stress state or in a hurry state, right then at that moment, trying to be in communication with that loved one who does have that dementia is really hard, and it's going to make it a lot harder for you as a caregiver because you're coming to them a little in a harsh stance, not so much like you said. Make sure you smile, in your body language and that eye contact is something that is very important.
yeah, and if they're not sure of who you are because their memory is affected in that way, they're reading whether it's safe, whether again, they're reading the environment. So not being
Exactly.
sure of who is approaching them, but at least that sense of calm and happy is already a good start.
Yes, I
So
totally agree.
communication can be challenging, especially when memory loss affects communication. Another thing that I often hear with my clients is, but my loved one is constantly repeating the same question over and over and over again. I've answered it. They'll ask it again a few minutes later. I'll answer it. They ask it again a few minutes later. Stacy, can you explain to our viewers why this happens?
You know what? I that's one of the questions that I hear even personally. I have some friends who family members suffering from some dementia and Alzheimer's. That's one of the questions that they always ask me all the time. So, memory impairment, it prevents them from remembering so many recent conversations. They may not recall that they've already asked that question over and over and have received that answer. So instead of becoming frustrated, try responding calmly inconsistently, recognizing that the repeated question may be a sign that they are seeking, reassurance, comfort, or just some sense of security, almost like a kid almost. So,
Yeah,
what
and
else would
I
you
would
add to that?
imagine then that since they don't know that they're asking the same question over and over again, for them it's the first time, and if they sense frustration from their loved one in that question, I know if I were asking a question and somebody responded, I might feel a little bit confused or scared or unsure because I didn't know that I had already asked that, or I'm not sure why you're responding to me in that way. So that's something that I definitely try to advise clients to do, or caregivers to do, is to put themselves in that person's shoes, that they don't know that they've asked the question. They only know how you're
Yeah, I
responding.
totally agree. Totally agree. You need to put yourself in that individual's shoes. I definitely agree with that. So, Michelle, when most caregivers find themselves answering the same question repeatedly, emotions can seem to run high. So, how would you say an individual should handle agitation, anger, or some type of a mood swing that they're receiving from their loved one?
Calm, stay calm, and assess the situation. Like you said, sometimes it's something that's going on within your loved one. Something is bringing on that reaction. And so you want to take a look at what could be causing them. They can't tell you exactly what's wrong, especially as the disease progresses. They may not be able to communicate that to you. So if they're in pain, if they're cold, if they're scared, if they're confused, if they're tired, they may not be able to tell you exactly what it is. And just like us, when we come home, sometimes tired, or we've had a really difficult day, we're not feeling ourselves and we may react to our family in a certain way. So when you have that with your loved one, it's really important that you stay calm and that you try to figure out what they may be telling you without using their words. Look around, see what might be making them uncomfortable, or might be causing pain. That's a good start.
Yeah, staying calm on our end as the caregiver is something that you have to consistently make sure that you're staying calm. Just self caring for yourself as well, and thinking about it, stepping back, taking a deep breath, taking it in.
Reassure them that they're safe, that everything is okay, and then try to move through the situation. If it's something that can be alleviated with action, you would definitely want to do that. And if not, then reassuring safety, and then maybe moving on,
Mhm.
distraction and other activity.
Yes.
All
Yeah.
right.
Yeah. Explanation.
Those same emotions and interactions can make things such as bathing and dressing another difficult activity. And another topic that comes up with our clients is that their loved one is not wanting to take a bath, is maybe being a little bit difficult when it comes time to getting dressed and getting ready. So, Stacy, have you found that as a concern with your clients, and what have you shared with them to help?
You know what? I have, and then working in healthcare, home health and hospice, and then in memory care and assisted livings. One of the things that people just need to think about, individuals are afraid sometimes. They're scared that they may fall. So that is one thing that you need to think about when you're in there. But maintaining dignity, keeping routines consistent, approaching the task calmly, and approaching that task respectfully for that individual. Often choices whenever possible. Select two different outfits, and so don't try to just, hey, what do you want to wear today? Give them those options. Give them the options so that they feel that they're in sense of control and they do have independence. Sometimes changing the day or simplifying the task can make that personal care activity less stressful for everyone that's involved. So I mean, I know how I feel sometimes, even when I need to get dressed. I mean, honestly, last night and this morning I was wondering, what am I going to wear tomorrow? So could just imagine what an individual who has dementia, when you throw all these things out, if they looked at my closet, of course they're going to be confused. So giving him those little choices, here's this, is either this one or is this one, I think that's going to make it a little bit easier when it comes time for for getting dressed?
Yeah, some of the things that could be helpful too is to think of maybe getting a bath wrap so that your loved one
Mhm.
maintains their privacy and dignity and feels like, okay, I'm not exposed, I'm not covered, and there's also a sense of warmth. Looking at their routine that they may have had before. Were they a morning bather? Were they an evening bather or afternoon? Is it too cold? Um, Maybe warming up the bathroom. The other thing too is to approach it and try to make it appealing to them. I recently watched a video where they gave us two different scenarios, one in which it was time for a bath and it was a duty and a responsibility. And it was something that was in the tone and body language again. And so the loved one did not want to go. But if you come in and you say, okay, it's time for a bath. Are you ready? I've got, the low lights. I've got this warm bath towel ready for you. A spa, or for somebody else, it may be okay, time for a bath and a shave, a shower and a shave, and then we're going to get
Mhm.
ready and go out. And which outfit would you like? The more that you can try to approach it in a pleasant way with a smile as something to look forward to, that could also be helpful.
Yeah, I think we watched the same video because I remember that happening as well. You know what? And like you said, keeping the bathroom so that it's not overpowering, overstimulating, having that warmth in there because, people get elderly people and people, they get cold a lot. So keeping it so that it's inviting for them to go in is something that definitely will help when it comes time for bathing and getting dressed. So, along with the daily care challenges, caregivers often find themselves and their loved ones thinking of health and safety. So, our next segment that we're going to get into is talking about health and safety around the home and with the individual. So, Michelle, when would you say an individual should reach out to their doctor and their care team with their loved one?
Definitely anytime there is a sudden change in their health or in the way that they're behaving. Um, I would call a
Hmm.
doctor. Dementia is progressive. Some people do progress faster than others, but it's usually a consistent change. You will not go from one day to the next with somebody that used to be pleasant and used to, um, be quiet and not quiet, but be on the quieter side, not really showing signs of agitation, that kind of thing. They don't go from that to
Hmm.
agitated, grumpy, difficult, not connecting from one day to the next. So if you see something like that, that would be a red flag for me, and I would definitely call the doctor. And honestly, anytime you are not sure, something is out of sorts, you can't really pinpoint it. Um, I would call the doctor and check in. Um, and then there's also the urgent care or the emergency room. But if in your gut or you have a feeling that this just doesn't feel right and doesn't look right, and think about that sudden change, um, and you've checked for comfort, for pain, for cold, for anything else that may be causing that sudden change, and nothing seems to connect, I would definitely call the doctor.
Yes. Like you said, anytime there, like you said, that gut instinct. And anytime there's a change in that person's condition or that behavior, that's when you definitely should be reaching out to the care team. They sleeping a lot more, like you said, their appetite, their mobility. So most definitely reach out to your care team. That's what they're there for.
And Stacey, if you go to the doctor and you're not quite getting the response that you want, advocate for your loved one. You know them better than anybody else. Your doctor is
Yes.
seeing them periodically. So you can really speak to that change, and what has happened, what they were like before, and that there is this sudden change. This is not something that has been, declining. And I would definitely say to advocate and to speak up and let the doctor know that you are very concerned about this, and it's okay, to
Yes.
do some additional checking.
Definitely. Yes. Like you said, advocation for yourself and your loved one, most definitely. So,
So, Stacey, what about nighttime confusion? That's another topic that comes up. How can a caregiver handle nighttime confusion, excuse me, or sundowning is what it's called.
you know what, sundowning is a true thing. I don't think people realize that it is something that is true until you're experiencing it. Sundown is a pattern of increased confusion, is agitation, restlessness in people with who have dementia, and it typically occurs in the late afternoon or evening. So you want to maintain your regular schedule, reduce evening stimulation, keep the lighting consistent. So up and down, up and down. Don't keep turning the lights up and down, up and down. Keep it just keep it steady. Just keep the lighting consistent. Encouraging daytime activity. Make sure you limit that caffeine, create a calm and um, inviting bedtime routine, and reducing the noise and distractions can also help improve sleep and decrease nighttime distress. If you go into, I'm sure a lot of people have probably gone into, do tours at memory cares, or they go to skilled nursing facilities, and you see when you go into skilled nursing facility, there's always a lot of agitation going on, overstimulation. That is not good for the person who has dementia in those types of things. So trying to keep everything calm, let the nurses know. But when you go into memory care, they're always doing activities. They have these individuals up, watching TV, they're listening to music, they're petting animals. These are the type of things that you want to kind of almost keep it consistent as the day and kind of wear them out as the day goes along. So that way, when it comes time for nighttime, everything they know that it's a routine, they're ready to go ahead and, go on to sleep. So what else would you add to that?
Yeah, just like us, if we think about it too, we tend to sleep better as we gradually
Mhm.
transition from our daytime activity and excitement into the evening. I always hear, we have to have our routine, we have to have our sleep hygiene, turning off the TV, the phone, electronics a few hours before bedtime, anything that helps our environment transition with us from daytime movement and activity into rest and winding down and then into sleep. The other thing that we want to keep in mind too is that with dementia and Alzheimer's, there could be a change in our circadian rhythm, that internal
Yes.
clock that tells our body when it's time to wake up and when it's time to go ahead and go to sleep. And just like if we travel to a different place. You and I just went to Georgia and it was a 3 hour time difference. We adjusted that. And then all of a sudden it's time to come back. And we were talking about that. And that was quite an adjustment. So think of it the same way for your loved one with dementia or Alzheimer's. Their circadian rhythm now is off, not because of a time travel change, but because that's what's happening in their brain and in their body. And it can cause them to be awake and alert and ready at times that aren't usual or don't align with our own routines.
Yeah, it took me a while to get back to my normal, time frame and getting up and everything because, we were ahead of time. So, and then, calling someone at 5 o'clock in the morning when you're up 8 o'clock was, oh, they're still asleep. So it took me a while to adjust when I came back because I can imagine how it is focusing for someone who does have dementia. Michelle, with that being said, keeping someone safe during the day and night often requires making some changes around the home. So, what type of safety changes would you consider, or would you recommend or suggest for someone around their home for someone who does have dementia?
Definitely, my first recommendation would be as abilities change with your loved one, is to look at what is safety. If you have a loved one that is maybe a little bit confused and doing things that could cause concerns, like leaving the stove on um,
Hmm.
and doing other things that could be dangerous, you want to try to keep those areas or keep your loved one out of those areas if you are not with them to supervise them. If there's any issues or concerns with mobility, you could install grab bars, especially in the bathroom where, like we've talked about, there might be some fear of
Very
falling. So,
important.
bathrooms,
Hmm.
stairs, that kind of thing. If you need to use gates to keep them away from stairs because you're concerned that they might fall down, that's another thing that you can do. But a recommendation that I would definitely say is a good one is to talk to your loved one's doctor about an occupational therapy assessment, because they can come in and really assess the home and see what is going on with your loved one and what their needs are and compare that to the home environment. And they'll suggest changes like there's a loose rug here and that's a fall risk, especially for anybody that's having trouble with balancing or not picking up their feet. And that can happen in Parkinson's, and Parkinson's patients or people living with Parkinson's can have a form of dementia. So you put those two together, and that could make it really difficult. So assessing using an occupational therapist is a good one. What would you suggest, Stacy, would be another one that they should think about in terms of safety?
I would say having a physical therapist. Also, physical therapy and occupational therapy, they kind of go hand in hand a little bit. But like you said, reach out to your physician and ask for a home safety eval, and always ask for, if you're going to ask for physical therapy, you need to ask for occupational therapy. Because just on a side note, you can't just have a occupational therapist come in without a nurse or a therapist coming in. So you're going to get any therapy in there, make sure you get all therapy, because they're going to work together as a team, as your care team from home health, and figure out what you need in your home and make sure that you have the appropriate um, grab bars, and the tape for the rugs, so they're always there to just give you all these little recommendations. So I would say physical therapy is most definitely another one for safety. But medication safety is also critical. Just make sure that all your medications are staying locked and secured in a location, and administer them according to the prescribed schedule to prevent any accidental overdoses, missed doses, or confusion about what medication has been taken. Taking proactive steps to create a safe environment can help your loved one maintain independence while reducing risks. Now they have lock boxes that you can store medication in, so your loved one can't get to it. They have those pill dispensers, and those things are great. Even if a person goes up and they've taken their medication and they forgot, and they touch it, where hopefully you're the ones distributing, the medication yourself, dispersing it, but it will basically say not time yet. It will say it out loud to that person. Okay, let me just go ahead and move on. So keeping medications safe, locked up, is most definitely another safety critical factor.
Yeah, especially if they're still independent. Maybe there's mild dementia or Alzheimer's and they're still
Mhm.
independent, and you just want to keep track that they are taking their medications. The machine will tell you if they didn't. Um, like you said, it will prevent overdose, or it can help prevent overdose. So I would say that that's a really good investment. And one more thing, too, that just came to mind is whenever possible, at least on a yearly basis, have a pharmacist review and reconcile medications that
Like,
your loved one is taking. It's sometimes we forget about those things, or we think that as medications are prescribed, you take them and you take them. But it's a good idea to have a pharmacist on a yearly basis take a look at what you're taking, making sure that there's no possibility of interactions, or that you're not taking a medication that may be too much or that is interacting with another medication. And also, when you have a change in a medication schedule or a brand new medication that's come on that will probably be long term, it's a good idea to just have somebody check and make sure that everything looks okay.
yeah, I was just talking with a pharmacist last week, and that was one of the things that he was saying, how individuals need to have a relationship with their pharmacist. I mean, their pharmacist is going to know, because how many times have individuals come out of the hospital and their PCP is giving them one thing, and they go to the hospital and they come out with something different. Going to that pharmacist and making sure that what you're supposed to be taking, making sure there's no interactions between the two, most definitely is important. And not just that, we talked about occupational therapy and physical therapy. When you ask for that, if it comes down to a medication situation, you can always request a nurse to come in from home health, because they're also there to help educate with medications, and can also help with, putting your pills in some type of order.
All right. So while we're talking about caring for loved ones, it's important to remember that caregivers need care too. And like what we do, Stacy, in being with a family caregiver, being there with them on that journey, providing consultation and um, education, and just being someone, we have definitely a wealth of knowledge in caregiving for the caregiver. So
Mm.
what would you suggest when you have a caregiver that comes to you for the first time, or is a new client, or even maybe a client that's been around for a long time, and they are just very stressed out. Sometimes they don't even recognize that there is burnout. That was definitely something that I didn't recognize in myself until after. Um, what would you suggest for your clients that are dealing with this stress and burnout?
When people call in and they just call in this, they just start talking. The first thing I try to get them to do first of all is just take a breath and breathe and slow down. So because they have so much already in their mind, they finally get that other person on the phone and they're just putting it all out there. But I would say, take breaks, ask for help. There's support groups out there individuals can join, but the first thing that you need to do is prioritize your own health first. So many times we do not prioritize, even as a parent. You can imagine how that is. We don't prioritize our own health first. Caregiver burnout can affect your physical health. It can affect your emotional well-being. It can affect your relationships with a lot of different people around you, where you're not able to even provide the care to your loved one when you're not able to take care of yourself and have so much burnout. Make time for activities for yourself. Try to recharge. You can do things such as exercise. Best thing I do is when I have some type of stress, I'm, spending time with my friends. So reach out to your friends, even if it's for a call or a text, or just take that little bit of time, spend some time with friends, go to brunch, go to breakfast, find a hobby, pursue a hobby. Just take a few moments each day for yourself. If that means getting up before your care receiver, your loved one gets up, just sometimes 15 minutes before them waking up, 15 minutes them going to bed, waking up. Just as long as you have a little bit of time for yourself and just being able to breathe. Just remember, caring for yourself is not selfish, it is something that is essential. So don't think of it as being selfish.
It's
What else
definitely
would you say?
necessary. How many times have we heard that you can't pour from an empty cup? And so we have to think of ourselves as that cup. We cannot care for a
Yes,
loved one if we are not in the right state of mind or the right state in your body. And
exactly.
your mind and body are connected. If you are stressed, I guarantee that that is having an impact on your physical health. Some of our clients may ask, but how? Yes, I do need to go out with friends. Yes, I do need to, but I can't. I don't have anyone, or I don't know where to
Hmm.
turn. I don't know what to do. So there are a couple of different options. One of the first things that I tell clients or people in the community that are caring for a loved one with a new diagnosis or later is get a binder or a notebook. You are going to have people that are going to offer you casually, oh, let me know if you need anything. Let me know if I can be there for you in any way. You say, yes, thank you so much. I'm going to put you in my notebook and I will reach out to you and put those people's names
Exactly.
in your notebook. At the time when you're stressed, you may not be able to think, you can't see past what's happening in the moment. But if you know that in your notebook, you have a couple of people that have offered, hold them to it. If
Yep.
I know you offered the other day, could you come and sit with my mom for 30 minutes while I take 2 laps around the block just to, clear my mind? So it's people that can help you with your loved ones, but it's also people that you can count on to help you. So, like you said, going out with friends for coffee, who lives nearby, who can go for a walk with you, who is your friend that can listen or your family member, who can just distract you and make you laugh. So you want to put those people in there as well. And then if you don't have family or friends that are close by that can help you take those breaks, consider hiring a caregiver, even if it's just
Yes.
once a week for 4 hours. Some agencies will do 2 hours if it's local, but to start looking around before you get to that point, or maybe even after this webinar, look around and start getting some names of agencies and see if you can budget for once every week, once every 2 weeks. What can you do to get a little bit of a break? And once you feel that, it will be helpful. Even just a few minutes, even just once a week, even once a month will still help you in some way. So keep those ideas in mind.
Yeah, there's also daycare centers that an individual can, take their loved one to while they go do other things. And some of the support groups also have the ability where they can bring their loved one with them to like a support group. That way, their loved one is off being cared for by like the person there. They can do some activities, have some little snacks or something like that. So just because you can't get somewhere, you can always still take your loved one somewhere else where you can also have that time separately. So yeah, that was a good idea. The binder is most definitely something because right there you're journaling, you're writing your questions down, everything that you need for yourself, you're getting it all out on paper. So I agree with you there. So
I'd
Michelle, we know
forgotten
that
about
burnout
the
can
daycare.
oops.
Sorry,
Huh?
sorry, Stacy. I had forgotten about the day center and the day center, and
Yes.
we also recommend that for our clients. But that is a good idea because it gives
Hmm.
them interaction and time. And that with regards to the support groups, you'd be surprised at how much you learn from other people that are in the groups. So it's
Oh
not just a
yes.
place
Yes.
to attend and vent. It's also a place to connect and to learn about resources or things that are working for other people that can be helpful to you.
Yeah, everybody's journey is different. One thing about the support groups is you have someone who's been in there maybe 3 years versus someone who's coming in for 2 months. Everybody's journey is the same pretty much. I mean, they're going to end up almost at the same place, but that's where you go and get that like when you have a friend who's older and they give you that advice, bounce things off of each other, but definitely making sure you're taking advice from someone else and someone else may have to say. So yeah, like we were talking about, burnout can affect every part of a caregiver's life, including their patients. So, how can one maintain patience while when caregiving can be so difficult, Michelle? What would you think?
It can be. Even when we have the best intentions and we think, we can care for a loved one better than anybody else because we love them. And there are times when it's difficult. Maybe the relationship isn't great. And so that, even sets you back a little bit more in terms of being able to connect and identify and have that patience. But I think practicing patience when you can, um, for me, we're always in this state of being alert because you don't know what's going to happen next. You don't know if your loved
Right.
one's going to fall. You don't know what's wrong with them. You don't know why they keep asking you the same question. So you're always, can be in a state of agitation or high alert, and that can make it difficult to be patient. So we have to practice taking time to breathe, taking time to just be, by yourself for a minute and just try to settle and ground yourself a little bit more. Find activities that bring you that sense of peace and calm because if you can do them, then they will help you when things get more difficult. I started doing meditation and I'd never done it before. And I don't know that I was doing it right, but I do know that I was able to maintain a sense of calm and patience a little bit more than I
Hmm.
had previously. There was just something between the breathing and the quiet and your mind and body. Um, Taking a little walk in nature. I always say that trees bring a sense of calm. There's just something about them that just brings a sense of calm. So so doing those
Yeah.
activities and also looking again to your binder. If you find yourself in a moment of stress, you need a break, go to your binder. Or what are those activities that can
Hmm.
help you with patience? What are those reminders that can help you to breathe? Step away if you need to for a few minutes and tell your loved one, I'll be right back. Make sure that they're safe, and then step away and try to find whatever it is that helps you settle down, get grounded, and be calm. What would you suggest, Stacey? Are there any other ideas that you can give our viewers?
I like you said, making sure you go back to that binder and looking what you've written down. Sometimes, I mean, I go back through a lot of stuff. I keep a book that I just date daily and go back through stuff. So like you said, keeping grounded. I mean, just stepping back and just realizing that you just need to take a deep breath because it is difficult, but just making sure that you have your own, inner peace is going to be something that's going to provide that patience for you when you're taking care of that loved one because it's a challenging situation. I mean, like I said, I put everything back to just like kids, you have to have that patience. I have to have patience with my own self sometimes too. So being
And
grounded, yes.
exercise is important. That will always help as well. And sleep. Sleep, if you are not getting enough sleep, which you may not be with somebody that may
Mm-hmm.
be having some sundowning or having issues with sleep, you may not be getting sleep. And that, of course, is definitely going to weigh down on you. It's going to impact your ability to remain calm and to have patience. So, going now back to somebody that can help with caregiving, whether that's a friend, loved one, or getting an agency that maybe can help get your loved one ready for bed and into sleep so that you can get a head start on your sleep and get a few hours in before you need to wake up, or if you're woken up in the middle of the night, or just helping you settle into bed, looking at where you can get help and looking at how you can make changes or how you can deal with things that may be impacting your stress levels.
Yeah, sleep is very important. Deprivation, that's one of the ones that we hear a lot from when we get calls that come in. People are just not getting enough sleep. So, yeah, I agree
So,
with you there.
Stacy, caregiving challenges become even more difficult with family members that aren't on the same page. Another hot topic with our clients and caregivers. How how can a caregiver deal with or talk to family who is not helping? What do you suggest to your clients?
Yeah, little family dynamics. That is something that is in every aspect of everything. So, one of the things you want to do is make sure you communicate very clearly about the level of care that is required and ask for specific support. Like you said before, individuals who will reach out and say, "Oh, let me know if you need help with your mom or your dad." Yeah, I do need help with mom or dad. Like you said, write it down specifically and let them know this is what your role is. They say, mom has an appointment at 11:45. When you call that family member up, just say, "Hey, I have something already going on over here. Mom needs to be at the appointment at 11:45. What time are you going to be here to pick her up?" Sometimes you just have to put it out there. Don't sit there and ask, "Are you available?" Sometimes you have to kind of let people know what you need their help and their support with. Because family members may not fully understand the day-to-day responsibilities of caregiving that you're doing, or realize how much help that is needed. So instead of making general requests, consider asking for those specific tasks. Like we said, you need some help with some respite care. You need help with the appointments. You need help running errands, assisting with financial and legal matters. Open up and be honest about the conversations. That way, it can help reduce any misunderstandings and encourage, more family involvement. Get the thing is to get your family involved and get them to buy in on it. What's going on with the loved one, because they don't know. They're not in it.
Yeah,
What else would you think?
sometimes you get
What
busy
else would
with
you
your own
say?
lives. And also
Yes,
having to
exactly.
accept oh, sorry, I think there might be a little bit of a delay. We also sometimes have to accept that some family members are just not going to be reliable for, whatever the reason is. Maybe they are not able to handle or see, your loved one, their loved one in that state. Maybe there's other reasons like they just don't want to, but I think at times we have to accept that we're just not going to get that type of support from them, and the sooner we can see that, we can move on. Also identifying who has strengths and what. If you People can help in different ways. They may not even think to offer that type of help. So if I know that I have a nephew that is on top of the phone and the social media and is very savvy, that's the person that I'm going to go to help me find resources in my area or
Yes.
to help me, research caregivers. If I have a sister that has a family or loves to cook, then you know what? When I have doctor's appointments, I'm going to call that sister and say, "This is what I need. Can you please, include a extra 2 or 3 dishes for us? We have a doctor's appointment, and I just don't want to cook when I get home." But being direct and talking to them, and putting in a little bit extra and knowing who you're going to go to with what, and putting that in that binder that can be helpful,
Yep.
helpful set of instructions and a resource.
Yeah, I had a friend it was some brothers. Their mother was coming out of skilled nursing, and they needed a little bit of help with some things. And when I called one to let him know that I picked up the referral, whatever was going on, he says, "Well, you need to call this person because there was three of them, and each of them had things they were doing. One was in charge of the medical appointments. One was in charge of making sure that Mom's house was ADA compliant when she got home and make sure the home safety part was taken care of. And then one made sure that they took care of the finances. So it didn't put you, and they all lived separately, out of town somewhere. Mom lived somewhere else. So it made it a lot easier because each person knew what their responsibility and their role was. And they worked together as a team to make sure that everything was taken care of when it came to their mother. And it was a smooth transition when she went back home from being discharged from skilled nursing.
Yeah, the sooner you can establish that, the better.
Yes, it is. And then one way to reduce stress is by planning ahead, understanding what resources may be available as care needs change. So, one of our next segments we're going to get into is planning ahead and understanding care options. So, at this time, Michelle, when would you consider professional home care that will need to come in and ask for additional support? What time? When?
Two different things that I would recommend home care would be important or would be the next step. One is definitely if your loved one's abilities are changing and they are becoming difficult for you. One of the hardest things
Yep.
that that most caregivers have to say is or have to think about is that they may not be able to provide the care that your loved one needs as much as you want
Mhm.
and as much as you want to try and as much as you're trying to save money. Sometimes there is a balance between what you're able to do and what's safe for your loved one and then in return for yourself too. You don't want your loved one to fall and then now things are even harder because your loved one is going to need more help. And if you are already stretched thin, this can make it more difficult. So if you're recognizing that, there is some safety, it is getting harder for you if you're working and you have family and you have kids or if you're in a state where you don't have the strength to do the physical like lifting to help your loved one, home care is a really, really good idea. So
Yeah.
those are the two, the change in needs for your loved one and also the change in your abilities to provide that support for your loved one.
Yeah. Most definitely planning ahead. We'll talk about this in our next segment, but session when it talks about home care, assisted living, and memory care. So I'll get into that a little bit later. So, anything else you want to add to the part about
Well,
planning ahead and
I think
understanding care options?
also, if you find that, like we just talked about, the stress levels, if it's getting more difficult and you just don't have the resources that you need, home care can also assist with that. You said medication management,
Definitely.
bathing, activities, physical therapy. Those are all things that can help alleviate some of the burden or the responsibility or the load, from you, and it also helps your loved one because somebody's coming in, they know how to do it, they know how to maneuver, they know how to talk to your loved one, and that gives them also a sense of like, "Oh, okay, it's okay. You don't have to worry about bathing. They can manage that for you, and that's something that will help you too." So think of it too, if it's something that will help alleviate some stress, then it may be worth it to talk to your doctor or to talk to an agency. Stacy,
Yeah, and
once
it doesn't mean
families
that you're giving up your. I'm sorry. Go ahead. Go ahead.
We're just so
Oh, I was just
excited
going
to
to say in
share.
that part. I know we're just so much. I was just going to say in that part, like you said, giving up just because you're asking for help doesn't mean that you're giving up on your caregiving role. You're still that person that's there that is that person's caregiver, but you're just just asking for help and reaching out for that support and making sure that you understand your care options and make sure you're planning ahead. So sorry about that, Michelle.
Okay. We're in it for the long run, so it's always good to think about, wait, I've got to do this for a while. It's better to, plan for the support so that you can manage this over
Hmm.
the long. All right,
Planning
Stacy.
ahead.
So once families begin exploring support services, they quickly realize that there are many different options available. One of them that we just talked about. What is the difference between home care, assisted living, and memory care?
Well, your home care provides support in a person's home. It can range from a few hours a week to around the clock care. And home care, people always get home care and home health a little mixed up. Home care is when you reach out to an agency that's a private duty and you do have to pay out of pocket. Some insurances will cover for you to have some type of home care. So it just depends on what type of insurance you have, and long-term care insurance policies, which are not out there as much as they used to be. They don't even sell them anymore. I don't even think, but that's when you want to look into your long-term care policy to see if you can get some home care, because you might have some, 15 hours, a week or something like that. So I would definitely reach out to your insurance. But home care is something that is not paid for by Medicare. Assisted living communities offer housing, they offer meals, social activities, there's housekeeping there. They get assistance with their daily activities. And the residents there still keep to be able to have some type of much independence as possible. So just because they may have to have someone come in to you know, give them a shower or change doesn't mean that they still don't have independence. They're still able to, in assisted livings, individuals still drive. I'm in assisted livings, I see them playing bingo. I see them in there, line dancing. They're still in there doing a lot of different things because that still is their community. That is their home. I would say memory care communities are specifically designed for individuals who have Alzheimer's or some type of form of dementia. Provide specialized training. The staff does, and the staff in dementia care facilities, they are trained to be in those type of communities. They have structured activities. The supervision is more enhanced. The environments are secured. We don't say locked, we say secured, because you cannot lock someone in the facility, but they are secured. Just understanding that these options can help families make more informed decisions, based on what their loved one needs. And one thing I wanted to say was, if you're to that point and you need to start looking around, don't wait until the last minute to do it. Know where you want to start taking your loved ones. Start doing tours of, excuse me, assisted livings in your memory care communities now, because that way, when that time comes, you're ready for it. Because I always say, when you get into assisted living or memory care, it's something that is a need. It's not a want. That's the difference between independent living. Independent is more of a want, but when you get into assisted living and memory care, it's a need, and things go fast. Things go really fast when it comes time when you get into that those type of care facilities. And take a tour. Go take a tour. Get all the information that you need. Be ready to avoid that crisis, like I said, before the time gets too late. So that is the difference between your home care, assisted living, and memory care. Anything else you would like to add,
I've
Michelle?
heard that there can be long waits for assisted living and memory care. So another reason to start early and start touring. And then if there's something that you have in mind, you can ask about the wait list and start getting registered for it if you see that it may be
Exactly.
coming sooner rather than later. And then there's also placement specialists that can help.
Hmm.
They'll connect with you and learn about what you want and what you need, and they can, make suggestions and offer to accompany you on tours and to get the process going. If there's a budget that you need to stay within, then they know that they're looking for places within those budgets. So consider a placement specialist as well. And then that's
Definitely. That
that's
that
all I
right
have.
there. But considering, like you said, the placement services, that right there is going to keep you organized. It's going to keep you a little bit more calmer, because they know they're already in these like communities, like you say. They know the ins and outs, and they know, even when they're talking with you and your loved one, where that fit's going to be, because you don't want to take someone who is used to living out in the country, or somewhere where there are a lot of trees and have animals, to somewhere that may have 4 floors and a 100 apartments on each floor. You need to make sure that you put them in a place that is going to be more suitable for them, and an environment that they're going to be able to thrive and strive in. So, anything
So
else you want to add to that?
Stacy, what about, we're talking about home care, skilled nursing, and assisted living. As the health of our loved one begins to decline, um, then, caregivers and family members need to start thinking about different options. And one of the areas that I find that there's some confusion and questions is regarding around the difference between home health care, hospice care, and one that people aren't as familiar with, which is an in between, is palliative care. What can you share
Mhm.
with our viewers about those three services?
And Michelle, that's a great question, and one that we come across as loved ones' conditions, abilities, and needs do begin to change. But home health, like I was talking about before, home health is something that is covered by Medicare, and it is a physician-ordered medical care that's provided in the home, and it's provided usually often when they're hospitalized, when they've had an illness, injury, some type of surgery. They may be able to get some skilled nursing, some physical therapy, like we discussed earlier, occupational therapy, speech therapy. A lot of times, speech therapy is very um, not ordered enough, I think. And when it does come to memory care individuals, speech therapy is something that I think that they really need to be in on for the individuals who are having the cognitive impairment decline, medication management, and just help a person recover from their maintaining their health. So I'm really big on home health. I mean, especially when you're not really moving a lot, because home health is going to help you with that strengthening. It's going to help. Home health is going to help you with so much. You know, your nursing, you said your physical therapy, and you have a whole team. And that team, I call them the ears and the eyes between the physician and you as a caregiver. So they're the ones who are recommending and suggesting things to the physician. So, and one thing, like I said, it is covered by Medicare. Palliative care. You want to talk about palliative care? I love palliative care. It's kind of a bridge between home health and hospice.
It is a bridge, and it's a service that I recommend to caregivers where their loved one may have more difficulty getting to doctor's appointments. Maybe their mobility has really become impaired, and there's so many appointments, and you got to think about how to get them there. And what if you don't have the transportation necessary? Maybe um, it's become too difficult to leave the home for care, and that's usually where I
Mhm.
suggest palliative care. It is not hospice, a lot of people don't know about it. You are getting care and support in the home, and the
Right.
medications and the treatment is still meant for comfort and for survival. Whereas the hospice we know is more like comfort care, as you're not
Yes.
trying to save the person or cure the person. It's really meant as comfort as they transition, to end of life. Palliative is still, we're going to support you at home. We're going to give you treatment. We're going to give you comfort care, but with the goal that we're still trying to keep the patient alive and surviving.
Yeah, one thing about palliative care too is that just because it's that bridge in between, you can still, if a person is on palliative care, their palliative care team can still request physical therapy, speech, occupational therapy. Like I said, you're still able to get the treatment when it does come to palliative care because it is that bridge. So, like you said, when you get into hospice, they start talking about individuals start needing, more support when it comes to symptom management. You get that emotional support, education, bereavement services. One thing about hospice, they will take care of all of the medications and all of the durable medical equipment that's needed in the home. So I always tell people hospice is help. Hospice is there for individuals who need some help, and hospice is a great service. Hospice is a great service.
Well, Stacey, it looks like
So
we're almost to the end of our session. Is there anything that we can add in terms of what we would recommend, or how can we help? What advice could we give to caregivers caring for a loved one with dementia or Alzheimer's?
what kind of advice
Or where
for loved
where
ones?
can caregivers find support? There's a good one. Where can caregivers find support?
Well, I would say support groups was one thing, and places like where we're from, caregiver resource centers. So make sure you reach out to your caregiver resource center because we have so much information and so many resources for you. Community organizations, your healthcare team, local agencies can all provide assistance. Caregivers often get the support and benefit from educational programs. Education is such a big thing when it comes to even with home health, because the thing is they're in physical therapy, occupational therapy, they're in there, you're getting education. I mean, you're getting education for whatever's going on with you, you're getting education for the goals that you need to have. So I would say that reaching out for support can help reduce some of the feelings and isolations that you're getting, and you can get some valuable tools for managing these caregiving responsibilities. So most definitely reach out to your families. You said your caregiver resource centers, most definitely.
Triple A's as well. If you have a triple A that you can
Hmm.
connect with, they can also help with connecting to resources, including caregiver resource centers. I'm so sorry. I wasn't sure if we were on a time limit. If we have time, I know I skipped a question, but if we have time, we can go for it. Stacy, you lead.
Okay, well, it was one of the things we just talked when we were talking about. That was that Michelle and myself were talking about is one of the questions that we always hear is when it comes to legal and financial planning, what families should consider. We would say important planning includes your power of attorneys, your advanced healthcare directives, wills and your trust, your beneficiary designations, and just your long-term care planning. Making sure you have these conversations early will help allow your loved one to express their wishes, get them involved in these things if they're able to. That's the decision making that they're going to be able to, be involved in. It's going to help you out in the long run because you're going to be, respecting their wishes. Make sure those documents are organized. Make sure you have your insurance coverage reviewed. Like I said, understanding your available benefits. We were talking about like your long-term care insurance for your home care. Discuss the financial resources that may help pay for future care. Taking these proactive steps can reduce stress, prevent family conflicts and those family dynamics, and provide peace of mind for everyone that is involved in taking care of your loved one.
Yeah, the one thing that I would definitely suggest, and it's experience, lesson learned, and something that I share is when I was a caregiver for my mom, she wanted to talk about these things and I wasn't ready because I didn't see that we
Mhm.
were going to be heading, in that direction. It was more of a we're going to hang on until there is a cure, until there's treatment, everything will be fine. And she tried a couple of times to talk to me and I felt like I was giving up or like I was accepting that that was the future,
That was
was that
it.
she was going to go, and I didn't want to do that, but in not being open and not having that conversation, it prevented me from really learning and understanding what she wanted to say, and unfortunately, we got to a
Yeah.
point where she was not able to communicate that anymore, and so that is a regret that I've had. Of course, I knew her long enough and was close enough to her that in general, like, I had a good idea of what she wanted, but when she wanted to talk about it, I was not ready to receive it, and that's a regret that I have and that I will definitely always share with anybody that wants to listen is that have that open mind and that open heart and that space, and that we should have those conversations whether we
Yes.
do see that as something in our near future or something far away. If there is something that we want for ourselves or that our loved one wants for ourselves, we have to be open and we have to be willing to share that so that our loved ones know what it is that we want and they know the decisions that need to be made when we can't speak for ourselves.
Exactly. I went through probably something similar with my mother. She kept telling us what she wanted, but it was like, is she really serious about this? What she really wants? But when that time came, she was able to go ahead and let us know what she did want. And the thing is, we just had to respect what she wanted. So, like I said, she was able to relay what her wishes were. And you know what? We made sure that those wishes were what she wanted, and it was beautiful. So,
Yeah.
so one of the most important things, Michelle, would you think that taken away from this conversation today, this discussion, that what is one thing that caregivers should remember?
I would say remember that caregiver resource centers are here to help and to support you. So if you
Hmm.
go to our webpage, I believe it's caregiver.org, you can search by putting in your zip code and see which resource center is in your area. Make a phone call and connect. Like I said, we are with you throughout your caregiving journey. So whether that be, until the end or until you decide you don't need services. And we're here to provide consultation and education, but also to help connect you to other resources in your community, including the support groups. So we're building a community and a network of support around you, and in in building that around you, we're also building it around your loved one. Sometimes
Right.
it's okay to be confused, to have questions, to have reactions, but bring yourself back to the person that you're caring for. Put yourself in their shoes, see the world through their eyes or their situation. Remember
Hmm.
to breathe. Remember the notebook that you're going to write in every time somebody offers you. You say yes, and you put their name down, and you use that. You utilize that. They're offering it. We got to take it up because, again, we're planning for the long haul here, and we have to make sure that we are taking care of ourselves so that we can take the best care of our loved one. What
Yeah,
about
and
you,
just
Stacy?
remembering that you're not alone. I would just say, just remember that you're not alone. You don't have the answers to all the questions. Just remember that caregiving is a journey that requires patience and flexibility, and it requires self compassion. Don't be afraid to ask for help and accept the support. And just remember, taking care of your own physical and emotional well being is going to only allow you to be a better caregiver while maintaining your own quality of life and making sure that your loved one has a good quality of life when it comes to that point. So, and most definitely, like you said, getting connected to a AAA or getting connected to a caregiver resource center, just making sure that you're staying connected and keeping yourself educated is one of the other important things I would like to say.
Yes.
So that looks like we're going to be about wrapping it up. You want to go ahead and lead us into our closing, Michelle?
Sure. Let's see. I had a speech all planned out, so now I've got to come back to it here. Okay,
That's
so
okay. But if you have a
all right,
speech, go
so
ahead.
as we wrap up today, we hope that the questions and the answers we've discussed have provided helpful information, reassurance, practical tools, and tools that you can use throughout your caregiving journey. Remember, caregiving is not something you have to do alone. There are resources, support services, and caring professionals available to help you navigate challenges that come with caring for a loved one with dementia or Alzheimer's disease or frailty. Thank you for spending this time with
Yes.
us today.
So, on
All
behalf
yours,
of
Stacy.
Passages Caregiver Resource Center and Coast Caregiver Resource Center, thank you all for that you do as a caregiver. Your compassion, your patience, your dedication is truly making a difference in the lives of those that you care for. So, take care, and we wish you all the best on your caregiving journey. Thank you.
Thank you. Bye.